I'm sorry, this medicine isn't covered by your insurance.
This is really common because, especially the start of the year, and we're getting into the start of the year in 2025, this is extremely common where pharmacists have to deal with this idea that medications that were previously covered in the previous year because of formulary changes or because of something else is not covered anymore. This is done by an organization called a PBM, or a pharmacy benefits management system, manager, if you will. They work for your health insurance company, and they have relationships between pharmaceutical companies and pharmacies. And the idea there is they can negotiate the best price for or on behalf of either like an insurance company or on behalf of your large employer, if you will.
Yeah, I decide which medicines you get.
I guess that's your PBM.
Wait, you're not my doctor.
That's right. I'm your insurance company's pharmacy benefit manager, or PBM. And I don't make as much money off this one.
And that's actually really true. The way drugs are chosen as to whether they will be part of the formulary or not is basically whether a PBM will make money off of it. It's not like every drug is something they'll make money off of, but it's actually kind of a little surprising, because what you will notice is sometimes brand name drugs will be on formulary because the PBM can actually make money on rebates and the like, while a generic drug may not be on formulary in the same way, or a drug that's been available for a long time suddenly goes off formulary.
Hope you feel better.
They denied coverage to over 1,150 meds. First of all, I feel like that's kind of low number, to be honest, unless they're talking about drugs in general. I'm also recognize I work with pharmaceutical companies. I appreciate them. However, this is definitely a biased perspective as well, right? Because the entire job of a PBM is to keep costs low. So denying drugs because they're not necessary, you'd be surprised as a pharmacist how often you saw drugs being prescribed that make no sense. Like you need to treat, say, allergies. You don't need to go straight off to a Medrol dose pack. Maybe a Benadryl will do for now. But sometimes doctors just don't want to deal with it, and they'll just directly go to the big problem and go, "Oh, we think that your big issue is just let's add the bazooka where a something small like a catapult. Well, catapult might be too big, but you know what I mean. Something minor will do." This is also, as you can tell, it's paid for by pharma, so recognize the bias, if you will. Right now, there is a big argument between PBMs and pharmaceutical companies as to who's to blame. PBMs are being sued by the Federal Trade Commission for not only sort of keeping the price of drugs too high and being anti-competitive, but overall, whether they're having an inappropriate impact on the market itself. I think this was being done in the context of, well, there's the FTC, and there are also some state attorney generals who are suing PBMs as well. So let's stay tuned for what happens there. No one should stand between you and your medicine. I think I agree with that in concept. However, I think the truth is that doctors also need to be better stewards. I think a really simple thing like telling your doctor what something will cost will be a major way to help doctors. The problem is the doctors don't know, the pharmacists don't know until you actually bill, because it's so complicated. If you like this, don't forget to subscribe to our channel.